And these Americans are here with me today because even though the government is closed, a big part of the Affordable Care Act is now open for business. And for them, and millions like them, this is a historic day for a good reason. It's been a long time coming. But today, Americans who have been forced to go without insurance can now visit HealthCare.Gov and enroll in affordable new plans that offer quality coverage. That starts today. And people will have 6 months to sign up. So over the next 6 months, people are going to have the opportunity, in many cases for the first time in their lives, to get affordable coverage that they desperately need. Now, of course, if you're one of the 85% of Americans who already have health insurance, you don't need to do a thing. You're already benefiting from new benefits and protections that have been in place for some time under this law. But for the 15% of Americans who don't have health insurance, this opportunity is life-changing. Let me just tell folks a few stories that are represented here today. A few years ago, Amanda Barrett left her job in New York to take care of her parents. And for a while, she had temporary insurance that covered her multiple sclerosis. But when it expired, many insurers wouldn't cover her because of her MS. And she ended up paying $1,200 a month. That's nowhere near affordable. So starting today, she can get covered for much less because today's new plan can't use your medical history to charge you more than anybody else. Sky-high premiums once forced Nancy Beagle to choose between paying her rent or paying for health insurance. She's been uninsured ever since. So she pays all of her medical bills out of pocket, puts some on her credit card, making them even harder to pay. Nancy says, they talk about those who fall through the cracks. I fell through the cracks 10 years ago, and I've been stuck there ever since. Well, starting today, Nancy can get covered just like everybody else. Trinace Edwards was laid off from her job a year ago today. 6 months ago, she was diagnosed with a brain tumor. She couldn't afford insurance on the individual market, so she hasn't received treatment yet. Her daughter, Lanace, a student at the University of Maryland, is considering dropping out of school to help pay her mom's bills. Well, starting today, thanks to the Affordable Care Act, Trinace can get covered without forcing her daughter to give up on her dreams. So if these stories of hardworking Americans sound familiar to you, well, starting today, you and your friends and your family and your coworkers can get covered too. Just visit HealthCare.Gov, and there you can compare insurance plans side by side the same way you'd shop for a plane ticket on Kayak or a TV on Amazon. You enter some basic information, you'll be presented with a list of quality, affordable plans that are available in your area with clear descriptions of what each plan covers and what it will cost. You'll find more choices, more competition, and in many cases, lower prices. Most uninsured Americans will find that they can get covered for $100 or less. And you don't have to take my word for it. Go on the website, HealthCare.Gov, check it out for yourself, and then show it to your family and your friends, and help them get covered, just like mayors and churches and community groups and companies are already fanning out to do across the country. And there's a hotline where you can apply over the phone and get help with the application. Or just get questions that you have answered by real people in 150 different languages. So let me give you that number. The number is 1-800-318-2596. 1-800-318-2596. Check out HealthCare.Gov. Call that number. Show your family and friends how to use it. And we can get America covered once and for all so that the struggles that these folks have gone through and millions around the country have gone through for years finally get addressed. And let me just remind people why I think this is so important. I heard a striking statistic yesterday. If you get cancer, you are 70% more likely to live another 5 years if you have insurance than if you don't. Think about that. That is what it means to have health insurance. Set aside the issues of security and finances and how you're impacted by that, the stress involved in not knowing whether or not you're going to have health care. This is life or death stuff. Tens of thousands of Americans die each year just because they don't have health insurance. Millions more live with the fear that they'll go broke if they get sick. And today we begin to free millions of our fellow Americans from that fear. Already, millions of young adults have been able to stay on their parents' plans until they turn 26. Millions of seniors already have gotten a discount on their prescription medicines. Already, millions of families have actually received rebates from insurance companies that didn't spend enough on their health care. So this law means more choice, more competition, lower costs for millions of Americans. And this law doesn't just mean economic security for our families, it means we're finally addressing the biggest drivers of our long-term deficits. It means a stronger economy. Remember, most Republicans have made a whole bunch of predictions about this law that haven't come through. There are no death panels. Costs haven't skyrocketed. They're growing at the slowest rate in 50 years. The last 3 years since I signed the Affordable Care Act into law are the 3 slowest rates of health spending growth on record.